बहुत बहुत धन्यवाद सर। भारत जैसा विविधता वाला देश जहां हर कोश में पानी, हर 2 कोश में वाणी बदल जाती है। 113 ICAR संस्थान, 70 से अधिक कृषि विश्वविद्यालय, 731 कृषि विज्ञान केंद्रों को जो नेतृत्व प्रदान कर रहे हैं, हमारे आज के इलिस्ट्रियस स्पीकर डॉक्टर ML जाट जी को हम सादर आमंत्रित करते हैं कि 56वां लाल बहादुर शास्त्री स्मृति व्याख्यान हम सबके बीच में प्रस्तुत करें। प्लीज सर।
Chair of the program, Professor Ramesh Sanji, Honorable Member, Niti Aayog, Government of India, Director of IARI, Dr. Srinivas Rao ji, Dean, Madam Anupama ji, many of my teachers, Dr. Anil Kumar Singh ji, Dr. Ashok Kumar Singh ji, I'm taking full name because 2 AKs. Dr. T.R. Sharma ji, Shastri ji, namaskar. The deans, directors, heads, colleagues and friends. First of all, my sincere gratitude to Indian Agriculture Research Institute for giving me this opportunity on a lecture on such a great son of India, late Sri Lal Bahadur Shastri ji, Honorable Prime Minister of India, and as Professor Ramesh Sanji indicated, he was the Prime Minister at the time when we were struggling or starving because of lack of food, but we are at a different stage. We have to take inspiration from Professor Sri Lal Bahadur Shastri ji, how he motivated the people of the country to cope up with that kind of scenario. Now we got a different scenario, and we have to cope up with that scenario. We need that inspiration, that motivation to communicate to the people of the country. And from that perspective, I was struggling to choose a topic. And sir, most of the work what I am going to share is not my work. But just to ignite some thought process on this new aspect, the new challenge what we are facing, especially the health of the people. And I think that's where we truly need to reimagine our agri-food system, connecting it to the health. I pay my tribute to the great son of India. I bow my head before him for all the inspirations, all the contributions to the country, to the people of the country, specifically Jai Jawan, Jai Kisan. And I think that's what was needed at that point of time. And that helped the country. Now, why are we talking about the agri-food system for health? Why agri-food system matters for health? If you look at the Indian Council of Medical Research report, which clearly indicates that more than half, precisely 56.4% of India's disease burden is linked to what we eat, the unhealthy diets. 56%. That means agri-food system have to contribute much more than the medical science to keep people healthy. And from that perspective, we truly need to reimagine our agri-food system. We have seen the increased intake of the highly processed foods containing added sugars, unhealthy fats, along with we have minimized our physical exercise. And lack of access to the wide variety of the nutrient-dense food. Access is also a problem, which is causing chronic diseases. And it's a challenge. And this leads to the serious non-communicable diseases such as obesity, which is one of the major problems now in India. We are struggling. And obesity is primarily because of the food. The type 2 diabetes, many heart diseases, hypertension, and many other non-communicable diseases. And the primary cause is food. Our diets and lifestyles are important modifiable risk factors to reduce the burden of those non-communicable diseases. So we have to do a good job in terms of our food systems. If you look at the economics, this poses a massive burden to the tune of $1.3 trillion annually, the total burden, of which 73% is because of the unhealthy diets. So that's the magnitude of the problem we are talking about. And I think in that context, we truly need to think seriously about designing our food system, reimagining our food system. Now, healthy food comes from the healthy soils, which is the foundation. And if you look at the soil, and this is the latest updated study on the soil organic carbon in India, coming from Indian Council of Agriculture Research. Most of our soils are very poor in organic matter content. And it's just not the organic matter, but that determines the response of other nutrients. The functioning of the soil, the response of the soil, not a good sign. And I think when we talk about redesigning, reimagining the agri-food system, we also need to think about our soils. We have to keep soils alive, not dead. So while designing, we have to consider this. The another aspect, the nutrient deficiency. Many of the micronutrient deficiency, half of our soils are deficient in micronutrients which are essential for the healthy food, for the nutrition. And I think that's another problem. Now we really need to have a balance. We need to design our food system which takes care of this. If we are not taking care of this, we can't expect nutritious and healthy diets. Now, challenges are compounding with simplified food systems. The oversimplification have created problem. Rice wheat, rice wheat, rice wheat. And I think that simplification from ease of doing business, these days we are talking about ease of doing business, fine. But sometimes ease of doing business is also putting us in a trouble. And it's complicating the situation. A lot of environmental degradation is happening. We have seen across the biodiversity, and we have seen some of the species are at the extinction. Biodiversity, plant or animal or the birds. For example, I was told that one of the bird in Rajasthan, in western Rajasthan, go down. The numbers left is only 120. So it's almost at the extinction. Same is happening with the other biota. And I think that's another problem. If we don't have the biodiversity, we can't think of healthy food. Climate change, need not to reiterate, it's posing problem every day, everywhere. And I think if we don't act and don't act now, it's going to be a serious problem. Climate change is complex, cannot be addressed with simple solutions. We need systemic solutions, and system needs to be designed accordingly. Malnourishment, because of the changing consumption patterns and access to the food, the availability of the nutritious and healthy diets is rampant. Obesity, all those kind of things. Gender and social inequalities is also a problem which is contributing directly or indirectly into the healthy and nutritious foods. And a lot of economic shifts, global economic shifts, which are creating another problem. So those are the challenges when we talk about designing or reimagining the agri-food system. I think we need to consider, are we addressing those challenges or not? Now on the other side, day before yesterday, Niti Aayog released a series of scenario reports towards net zero under the dynamic leadership of Professor Ramesh Chandji, clearly indicate what we have to do with the business as usual scenario, what is going to be the case for the emissions, the overall emissions of the agriculture, and if you see the net zero scenario, how the emissions looks like now, where to find that mitigation opportunities. Again, designing of the agri-food system is very, very important from the net zero perspective. Now, let me make it a bit more complicated. So the climate, agri-food system, and health, that cocktail, that complexity, is another problem. So the climate change is not only impacting the productivity of the crops and livestock and other things, but also there is a lot of interlinkages with viruses, diseases, nutrition, all those aspects. And I think overall it's impacting the health of the people. Occupational health, otherwise also. So it's very, very complex, and I think we truly need to think about designing the agri-food system which can help in addressing this complexity. Now, our current production system are primarily commodity-centric, production-centric, calorie output-centric, and not taking care of the nutrition. They are not nutrition-centric. We need total output, which is really not going to help us. Our systems are monocropping and too much dietary simplification, which is also not going to help us. We have less of the focus, though we talk about, on the environmental sustainability and the consumer health. They are not taking care of these aspects. They are also limiting the consumer awareness, the farmers' awareness about this complexity because of the simplification. They are not appreciating what is going to happen to the water, what is going to happen to soil, what is going to happen to the environment, what is going to happen to the health of the people. So I think lack of awareness, I'm not saying they are doing intentionally, but I think lack of awareness is a challenge. And also, we got a fragmented governance across different sectors. The health differently, the agriculture differently, the horticulture differently, animal husbandry. I think that is also a problem, because the agri-food system is inclusive of all those aspects. So the lack of or fragmented governance is also a problem for us. Now from that perspective, if you look at the agriculture and health, they are inseparable. When we talk about the healthy food, we need healthy soil to make human healthy. And in between, there is a microbial loop. and we are not focusing on that microbial loop. I think from the soil to the gut microbiome is something very, very important from our food systems perspective. And that's what we need to do, that's what we need to design our systems, which takes care from the soil to the gut microbiome. And I think if you look at the impacts of the agriculture on the health, the food availability, the diversity and affordability, those three factors are very, very important. Nutrition primarily from the micronutrient perspective is very, very important. But at the same time, the food safety and AMR, antimicrobial resistance, is also very, very important. I think we need to think seriously about AMR as well. A lot of zoonotics issues, and we've been working on One Health program, but which is primarily the livestock, so those zoonotics, but again in isolation. I think we have to paint the full picture from the health perspective, the One Health perspective. And the environmental health, the soil, the water, the air. I think watersheds we've been working, but how about the air sheds, other aspects. So I think that's where the connect. And again, as I said, that microbial loop is something very, very crucial from the healthy food perspective. So with that background, what Hippocrates 2000 years back said, let food be the medicine and medicine be the food. And that's what is really needed from the perspective of designing or reimagining the agri-food system for health. Now, I'm trying to make you a little confused with this complicated, a bit of complicated figure. The Niti Aayog put efforts for reimagining the agri-food system quite a few years back, what kind of food system focus we need to have for health. And I think if you talk about science-based policy, and that's what they are talking about, science-based policy recommendations for sustainable agri-food system, which clearly indicates that we need to think about dietary supplements, we need to think about establishment of the community kitchens, we need to think about promotion of the planetary healthy diets, we need to think about establishment of the decentralized cold storages and the promotion of the agroeconomically suitable crop diversification options and enhancing the role of the digital tools and technologies. And that's what is the part of the whole agri-food system. Agri-food system is just not the production, but it's the complete value chain. And I think the value chain is something very, very important. So we really need to design our food system. Now, it's not, we are not working on those aspects. We are working on those aspects, but working in silos, working in isolation. And they are not connecting, they are not coupling. That's the problem. So when we talk about agri-food system, we talk about a connect. And connect is something very, very important. So we really need to transition from a commodity-centric agriculture to the sustainable agri-food system. And in that context, if you look at the priorities or priority areas to guide us towards sustainable intensification or transformation of the agri-food system, we need to think about sustainable production. But at the same time, we talk about sustainable nutrition. We need to talk about sustainable environment and also sustainable livelihoods. And all those together interconnected, which can really help us in sustainable transformation of the agri-food system. But at the same time, we also need to look at the synergies and trade-offs between the different aspects, those four aspects, and the expectations what we have from the food system. We have a lot of expectations. So we need to consider those expectations while designing or considering those four important pillars of the food system. Now, from that perspective, the Indian Council of Agriculture Research and our stakeholders and partners been working on biofortified products of plant and animal origin. We have done real good work to improve the nutrition, to help in the health, but also integration of all those is something important. The issue is, we have been working on biofortified crops and varieties and animal products, but we know what is the content. We don't know what is happening to the health of the people. In the lack of the clinical trials, those studies which are missing. And if you don't have that connect, the policy planners will not appreciate that. So we truly need to bring that connect, and I'll come to that in a while. And from that perspective, if we talk about nutrient-dense varieties of the crops, we got 205 crop varieties, half of, or more than half of the wheat is biofortified, whatever is grown today. Of those 16 crops with 9 nutritional traits. It's a lot of work. Still, the number in terms of malnourishment remains the same. Now, where is that going? I think we need to understand. And that's where, until we have the loop, I think we will not be able to tell where is that going. Whether it's helping in the nutrition and health or not. We've been working. So that's what I said, the silos. And I think silos are not going to help us. We need to put everything in a systems perspective, in a food systems perspective. Same is the case for the horticultural crops. We got 20 biofortified varieties of different horticultural crops. We got sweet potato with a different traits, which are helping in terms of the health. They are proven. Potatoes, bananas, pomegranate, having different nutritional aspects into those varieties. But what is happening when it goes to the consumers, whether it's going or not, if it is going, what is happening to that? I think we need to understand. Again, that fragmented approach in silos is really not going to help us. Now, biofortified products of the animal and the fish origin. If you talk about the dairy, 7 milk-based products and 5 egg-based products developed by the institutions. What is happening to those products? There are a lot of fish-derived products developed by our institutions which are nutritious, which are helping in terms of the healthy diets. But where are they going? Because they are in isolation. I think there is no connect. That connection is missing. And that's what can help us if we talk about reimagining our agri-food system. Now, there are a lot of food items for non-communicable disease management and prevention. And there are examples from the food grain, the low glycemic index of the rice, of the maize, the high lysine content, tryptophan, provitamin, all those things. IARI have done a great job in terms of maize. The Maize Institute have done. The mustard. I think there are a lot of those products, but the clinical trials are missing. And I think without that complete picture, again, the investment, which is guided by the policy planners, is not happening. So we have to inform them with a complete picture. The seafood, there are many, many items. The goat milk is proven. The camel milk, the donkey milk, a lot of properties which are very, very helpful for the health. They are there. It's our work. We have done it. But still, I think we are missing the opportunity. Now, I would like to cite this example. The African swine fever, a century-old problem in Africa, now entered all across the world. This is one of the major issues these days. I'm feeling proud that our institutions have come up with a vaccine. It's under field, and we are 100% sure that this is going to be the world's best, cheapest vaccine, which is not only going to help India, but whole of the world. So we got those aspects, those products available, but we have to integrate those products. So I'll not read all those things, how vaccine came up, but I think I thought of sharing with you that we got something exciting which our scientists have been doing and working on. There are a lot of nutraceuticals from the fruits and vegetables, and there's a long list. Those nutraceuticals are helping in many of those aspects in terms of the health benefit, in terms of the medicine, all those. So I'm not going to read this, but there are a whole lot of that is available. Evidence is available. We have to make use of those and connecting those towards the health. There are nutraceuticals from the aquatic production system. Again, there is a long list of those, but I think they are in isolation here and there. We haven't put them in a right perspective. So we are already contributing. We have a lot of aspects, a lot of products which can offer the health benefit to the people. Seaweed. We have seen seaweed. The biostimulant part is one, but I think a lot of seaweed products which are helping in the health. They got the health effect. And there is again a long list on the work done by our institutions at ICAR, which can help the people, which can help the community. There are many, many innovations and the products which are at the production stage, which are in the field already, which are with the farmers already. For example, crops, the n number of varieties and the crops, but at the same time, the nutri-cereals, the millets, we got a lot of health benefits, and we were very, very successful in raising the awareness about the millets. But at the same time, the precision ag and AI technologies, which are helping in terms of reducing the pesticide load and all those things, which is in turn helping in the health of the people. The vertical and protected farming technologies, they're also helping in terms of the health. And the alternative proteins. Now there are a lot of scope, the new market for the proteins, plant-based proteins. We can extract proteins from the high protein crops, and there is a market. So I think, and that helps in the health and other aspects. Now, all those things in isolation, but I think we need to put them in a system. And that's where the country been talking, and we got a strong focus on integrated farming systems. On all those components what I indicated are part of the integrated farming system. But integrated farming in isolation and those things in isolation is truly not going to help us. So we have to bring that element together in terms of the integrated farming system. And now we started working. What is happening to the farm household who got an integrated farming system in terms of the nutritional profile and the health versus those who are on the simplified systems? We have to have documentation and a study on that, which we have started. Now, if we talk about the future pathways, the innovations, the science, and the enabling policies, that's what is something important. Not only science, not only innovation, and not policy in isolation, but I think all together for transforming the agri-food system. And I think that requires the synergistic scientific innovations, sustainable agroecological practices, and inclusive policy design to align our food system with public health, with environmental resilience, and rural livelihoods. All those connects together. And from that perspective, let me cite this example. Now we got 4 systems. The cereal monoculture system, typical rice wheat. You can see the nutritional outputs in terms of the calorie per capita, the water use, and resilience to the climatic shocks. It's low. It's not sustainable. It's not giving us sufficient protein. So I think we have to choose. If we diversify a bit with a cereal pulse rotation, 70% cereal, 30% pulse, it improves the nutritional outcomes, at least from the protein perspective. That reduces the water use and provide a medium level of resilience to the climatic risks. But if we move toward the millet-based system, that further helps us in terms of improving the protein and micronutrients, reducing the water use, and also having the high resilience to the climatic risk. But if you go with the integrated farming system, which cereals, legumes, vegetables, livestock, fish, all those aspects, you can see the calorie goes up, the protein goes up, the all micronutrient profiles goes up, and the water, compared to the millet, it got more, but it's recycled water, so the total is not that much, and very high resilience to the climatic risk. So we need to bring all those elements here and there, put them in a right perspective in an integrated farming system. But everything will not work everywhere. Now we have to design our system looking at the biophysical and socioeconomic and market, everything, and then take them to the next level. Otherwise, if we want to do everything everywhere, we will be lost. Now, another dimension is on the occupational health. We are talking about agriculture. So there are a lot of effects, and the ICMR done a quick study recently. There are a lot of issues in terms of the occupational health, which we are not taking care. But I think we are bringing that dimension, so ICAR and ICMR together, trying to focus even on the occupational health. There are issues of the heat stress, pesticide exposure, zoonotic diseases, the respiratory hazards, and other aspects, muscular, other things. I think we truly, they are not only helping, impacting these people, but their impact is impacting the productivity in the agri system, because if they are not well, they will not be able to deliver, which is having impact on the productivity. So there is a connect between the occupational health and the agricultural productivity. So from that perspective, we truly need to reimagine our agri-food system for the health, looking at different pillars. And from that perspective, those 4 pillars, I think the first thing, the context and the challenge we have to see. What is the context, what are the challenges, and we design our system, for example, malnutrition or non-communicable diseases or zoonotics or the AMR, from that perspective. Also the nutrition system, so safe, diverse, affordable diets. I think that biofortified, all those aspects we need to see. We also need to see the institutional convergence, the cross-sector collaboration, deep research and development, and all those linkages with the farmer-producer organization, and circularity of the sustainability. Circular sustainability is another aspect. So those 4 pillars we have to work on and design a healthy food system. Nutrition-driven production, sustainable and climate-resilient agriculture. The food safety is something important. How we contribute to the One Health, and also integration of the new innovations and the technologies, for example, artificial intelligence. So I think that's what is the framework we truly need to design for transforming the agri-food system for health. And from that perspective, if I look at re-envisioning the ICR's research focus, I think we have to evolve from the production-centric agriculture to the orchestrating agri-food system for health. And this requires a lot of change, the internal reorganization, the new partnership, and relentless focus on the measurable outcomes, not just in terms of the tons per hectare, but also nutrition and health outcomes and farmers' resilience. And for that, we need new science and innovation, which is fundamental for reorientation, looking towards all those aspects. We also need to have not only science and innovation, but how to deliver. So science of delivery is equally important, from sustainable production and responsible consumption perspective, both, not only production, sustainable production, but responsible consumption, and then informing the policy so that they can make decisions based on the science evidence. Now, I think any country, any nation to be healthy and prosperous, the people need to be healthy. That's fundamental. And people to be healthy, we need healthy food system, which requires science evidence-based policy and investment, and that requires reimagining the agri-food system. So with this background, we have recently almost initiated a joint program between Indian Council of Agriculture Research and Indian Council of Medical Research, program called Sehat, the Science Excellence for Health through Agricultural Transformation. We are going to launch it soon. And I think connecting agriculture to the health is something very, very important. We are doing half work, they are doing half work. To make it complete, we have to work together. So we are in that direction, and that's why we are talking about reimagining agri-food system for health. Finally, imagine healthy, grow healthy, eat healthy, and stay healthy. Thank you so much.
जी आप सभी से अनुरोध है एक बार स्टैंडिंग ओवेशन होके ताली की गड़गड़ाहट से हम अभिवादन करेंगे। साथ में हमारे साथ जी और हम इन तालियों से ना सिर्फ आज के व्याख्यान के लिए सर को धन्यवाद दे रहे हैं, याद कर रहे हैं, साथ में लाल बहादुर शास्त्री जी की स्मृति को भी अपने हृदय में धारण कर रहे हैं।